Even though there are only 10 supplement plan letters, every state has different costs with a bunch of different insurance companies that offer them. So a conservative estimate is that there are 3,500 different supplement plan combinations to potentially cover in this video for all of the nationwide options. I'm going to give it an honest overview of the 3 most popular supplement plan options available in the country right now, and it will be a general overview, not specific to a state. Those are the Plan G, Plan N, and High Deductible Plan G. There are 6 categories that most people look at when they are picking an insurance plan, and we'll use these categories to review these supplement plan options. Okay, the first topic here is how much will this supplement plan cost you in monthly premiums? We're kind of starting with the big negative to supplement plans. This isn't intentional, we're just keeping consistent with other videos that we've done, but supplement plans have monthly premiums. These premiums are usually age-based. The technical term here is attained age. So every year, your supplement plan premium is based on the age that you have attained, and it will increase in cost as you attain a new age on your birthday. So a 68-year-old will pay more than a 67-year-old, who will pay a little bit more than a 66-year-old. In addition to the annual age bump, insurance companies typically do a rate bump across the board for everybody to account for inflation and rising healthcare costs. So it's not uncommon to see 2 premium increases every year with a supplement plan. Some years you may see little to no increase, followed by another year with a bigger increase. But the bottom line is your supplement plan premiums do increase over time. There are supplement plans that are called issue age plans, as well as community rated plans. They aren't as common, but they do exist. They do not increase based on your birthday. However, these plans typically start a bit higher and still have increases based on inflation and rising healthcare costs. We hear from people all over the country who are in their 70s and 80s who get priced out of a Plan G because of those premium increases, and they are paying upwards of $300, $400, $500 a month for their supplement Plan G. For those on a fixed income or worried about retirement budgets, that's a lot to deal with. Okay, the national average premium is right now around $130 a month or $1,600 per year for a Plan G. There are states where they start at around $300. So again, where you live matters. For Plan N, the national average is about $100 per month for a 65-year-old or $1,200 per year. And for a high deductible Plan G, the national average is right about $60 per month or just over $700 per year. So you can see how the fixed monthly premiums can be alleviated as you move down these plan types. A negative when it comes to supplement plan premiums is that you cannot use your HSA dollars to pay for supplement plan premiums without a penalty. So if you have a large HSA saved up to cover these costs, well, you can't use those dollars for supplement plan premiums. You can still use your HSA to cover the deductible, just not the premiums. In addition to these premiums, remember you still need to pay your Medicare Part B premium. The base amount is $174.70 per month, or another about $2,100 per year. This goes up for those with higher incomes. So yes, premiums are something to be aware of here with supplement plans. A lot of fixed costs that you need to pay whether you use the healthcare system or not. But let's keep going. Topic number 2 is, what do the plans cover? Supplement plans fill in the cost-sharing gaps of original Medicare Part A and Part B. That is your hospital coverage and your medical coverage. That's it. Supplement plans do not cover prescription drugs, dental, vision, hearing, or services that are not covered by original Medicare. So if you want prescription coverage, dental, vision, or hearing, you need to purchase those plans separately from your supplement plan, and each of those come with their own premiums and cost sharing. Topic number 3 is all about out-of-pocket costs. How much will you need to pay when you need to use the healthcare system? These costs come again in the form of deductibles, copays, or coinsurance, and this is where supplement plans start to shine. More specifically, Plan G and Plan N. The deductible is the dollar amount that you have to pay before insurance starts to help out at all. Plan G is the most rich benefit, where all you need to pay is the Part B deductible, which in 2024 is $240. After that, your Plan G will cover any Medicare-approved service 100% as long as it was done by a provider or facility that has not completely opted out of Medicare. Remember, Plan N generally has lower premiums than Plan G, and here's why. Plan N and Plan G cover all of the same stuff, except you will have an up to $20 copay for each office visit. You will have an up to $50 copay for each emergency room visit that does not end up with you being admitted into the hospital. And Plan N does not cover excess charges. Here's what excess charges are. There are 3 provider designations within Medicare. They either participate, meaning they accept Medicare assignment, they do not participate, or they do not accept Medicare assignment, or they have completely opted out of Medicare. If they've opted out of Medicare, you're not getting coverage with any of these plans. If they participate, you're getting coverage with all of these plans. If they do not participate, the provider can charge up to 15% more than what Medicare allows, and then you are responsible for that 15% difference or excess charge with Plan N. Plan G will cover that, Plan N won't. Okay, high deductible, Plan G. As the name suggests, it has a higher deductible that you need to pay first, and then your plan will start to kick in. In 2024, that deductible is $2,800. That $240 Part B deductible is included within that $2,800 high deductible plan. You would pay the first $240 for Part B services, and then Medicare will start paying 80% of Part B services, and then you would start to pay the 20% coinsurance until you meet the rest of the $2,800 deductible, so another $2,560. There is one unique situation where if you meet that $2,800 deductible using only Part A services, you would still need to pay the $240 Part B deductible in addition to the $2,800 deductible. Medicare Part B does not start paying its 80% cost sharing until the $240 Part B deductible is met. After it is met, high deductible Plan G works just like regular Plan G. It covers all approved Medicare services provided by providers who have not completely opted out of Medicare, 100%, including excess charges. So you can see that you get what you pay for when it comes to these plans and their out-of-pocket coverage. Pay more for Plan G initially, very little cost sharing. Pay a little bit less monthly for Plan N, but if you visit providers a lot or the ER or providers that don't participate with Medicare, your cost sharing will be higher. Pay a lot less in monthly premiums for a high deductible G, and then you have that high deductible coming out of pocket first. Now here are the potential risk numbers including premiums, both for the plan and Part B, as well as the cost sharing through deductibles, copays, and coinsurance. Plan N will really depend on how often you see a provider or the emergency room, and whether you're going to providers that participate with Medicare. Okay, the fourth topic is the network. What providers and facilities can you use? This is one of the biggest advantages of supplement plans in my opinion, and that is that there is no network. We covered this a little bit with the 3 types of providers. Here are the numbers around that. 97% of all non-pediatric providers and facilities in the United States participate with Medicare. 2% of non-pediatric providers do not participate with Medicare, and 1% of non-pediatric providers have opted out of Medicare. So with a Plan G or high deductible Plan G, you have access to 99% of all non-pediatric providers nationwide. That's impressive. Mayo Clinic, Cleveland Clinic, a lot of these types of facilities do not contract with most Advantage plans, but they do with Original Medicare. Now with Plan N, you just have access to 97% of all non-pediatric providers nationwide. That's still pretty awesome. And you can still see the other 2% of those that do not participate with Medicare. You're just going to be paying them that excess charge. If you travel a lot or you spend a lot of time in different parts of the country as a snowbird or multiple homes, supplement plans take a lot of the stress out of this decision. All right, the 5th area to cover would be other perks. You'll hear about a lot of plans that come with all of these perks like gym memberships or over-the-counter benefits where you get dollar amounts for certain items, grocery benefits, rides to and from doctors, and a lot of other things. These are Advantage plans. These are not supplement plans. There are supplement plans that come with a gym membership, but these are the exception, not the rule. I mentioned this before. Supplement plans are basic. They cover Part A and Part B gaps. That's it. They don't come with a lot of bells and whistles, sort of like the Honda Accord of insurance. You can get other plans that will fill in these gaps or get other perks, but again, those are going to have their own premiums and they're going to have their own cost sharing arrangements. Let's wrap this up with how easy is it going to be to use the plan when you need it. A huge benefit to supplement plans, all 3 that we're talking about here, is that they pay secondary to Medicare. Well, what does that mean? That means if Medicare covers it, the supplement plan covers it. No questions asked. This is very comforting to a lot of people to know that they can most likely visit the doctor that they want, and if the doctor recommends a procedure approved by Medicare, it's happening. Now, Medicare does not cover everything. There are still denials and prior authorizations that happen with Original Medicare, but it's not quite the same as with the Advantage plans that we've touched on a little bit. Medicare supplement plans are standardized. A Plan G in California covers the same thing as a Plan G in New York or any other state. Same with a Plan N or a high deductible Plan G. They're the same across states. There's a difference between the plan companies. Now we'll look at just Plan G for this, but this applies to all of them. Different insurance companies charge different premiums for the same plan. So a Plan G may cost you more or less with one insurance company than with a different insurance company. Probably more importantly is the rate of the increases that we talked about all the way back at the beginning, and they will differ by insurance companies. What I mean by that is that some insurance companies have more stable, predictable increases in their premium bumps every year. Others are more volatile with potentially larger increases in certain years. Customer service is different between insurance companies. The customer service procedures and the location of the customer service team, whether that's US-based or foreign, depends on the insurance company. The speed at which the insurance company pays claims is different based on the insurance company. All right, let's wrap up this section of how easy it is to use the plan with how easy is it to switch supplement plans. The answer is, like most things with Medicare, it depends. Supplement plans have windows of time where you have guaranteed issue rights for a policy without needing any sort of medical underwriting, meaning without the worry of being denied or charged extra for pre-existing conditions. For those going on Medicare at 65, you have that supplement plan open enrollment period, and it starts on your Part B effective date or your Part B start date, and it ends on the last day of the 6th month after your Part B effective date. You do not have to go on Medicare at 65, more specifically for those still working and covered by a company plan, or the spouses of those covered by a company plan. So for those that get Medicare after age 65, you have a 63-day special election period window from when your company plan coverage ends to get a supplement plan guaranteed issue. Now, once you are on a plan, things get a little bit tricky, and I have a video over here that goes over switching back and forth between Advantage and supplement plans, but for supplement plan to another supplement plan, where you live matters. In New York and Connecticut, you have the most freedom. You have guaranteed issue year-round. Supplement plans are some of the most expensive in these states, but you can switch year-round. In Massachusetts, insurance companies are required to offer guaranteed issue from February 1st through March 31st of every year. Insurance companies in Massachusetts can choose to keep that open all year if they would like. In Vermont, some insurance companies offer guaranteed issue year-round. In Maine, you have the guaranteed issue right to switch your supplement plan to one of equal or lesser benefits if you haven't had any gaps in your coverage that lasted longer than 90 days since you first enrolled in a Medicare supplement plan. So you can go from a Plan G to a Plan G or a Plan G down to a Plan N because it is equal or lower, but you can't go from a Plan N to a Plan G under these same guaranteed issue stipulations because you're going up in benefits. Also in Maine, insurance companies have to offer Plan A to anyone who applies during a 30-day window every year. Let's move all the way to the opposite end of the country for this one. In Washington, those with a Plan A can switch to another Plan A without underwriting. Residents with any other plan can switch to another plan with greater or lesser coverage without underwriting. This is for those already on supplement plans. Missouri has an interesting anniversary rule where you can change your supplement plan once per year on your plan's anniversary. This lets you switch to any other insurance company offering the same supplement plan letter for a lower price. There are 8 other states, California, Idaho, Illinois, Louisiana, Nevada, Oklahoma, Oregon, and Maryland, that all have their version of a birthday rule where around your birthday you can switch from a supplement plan to another of equal or lesser benefit. Finally, to throw a little bit of a wrench into all of this, for the other states, an insurance company can decide to allow people to switch without underwriting. We have one company in our state that allows a switch from one plan with a different insurance company to the same plan with this insurance company without medical underwriting. They're the only company in our state to do this. So some states have laws in place to make it easier for you to switch, others don't, and in the ones that don't, insurance companies can kind of do what they want around this topic. Here's the point I hope you take from this video. Every option has strengths and weaknesses. Medicare supplement plans work great for a lot of people, especially those that can afford the premiums. They are also not for everyone. Plan G is the most popular of the supplement plans for the reasons that we've discussed, but not everyone can afford a Plan G or a Plan N or a high deductible Plan G or the increases from these plans each year. So weigh these factors for yourself and then head on over to this video where we give an honest review of the supplement plan's biggest rival, the Medicare Advantage plan. I will see you over there.